Hello and welcome. Today we're diving into the complex world of mitochondrial encephalomyopathy, lactic acidosis, and stroke-like episodes, or MELAS. This rare but serious disorder affects the nervous system and muscles, and we'll explore its causes, symptoms, and current approaches to management. MELAS stems from mutations in mitochondrial DNA or mtDNA. Mitochondria are often referred to as the powerhouses of our cells, responsible for generating energy. In the vast majority of cases, the most common mutation, accounting for over 80% of individuals, occurs in the MTTL1 gene, which provides instructions for making a transfer RNA to tRNA. These tRNAs are essential for protein synthesis within the mitochondria. However, mutations in other mitochondrial genes can also lead to MELAS. The disease is typically inherited maternally, meaning it's passed down from mother to child because mitochondria are inherited from the egg cell. At a cellular level, MELAS disrupts the electron transport chain within the mitochondria. This disruption impairs the ability of the mitochondria to produce energy in the form of ATP, adenosine triphosphate. The organs and tissues with high energy demands, such as the brain, muscles, and nerves, are particularly vulnerable. The inefficient energy production leads to a buildup of lactic acid in the blood and tissues, causing lactic acidosis. Additionally, the energy deficiency and impaired mitochondrial function affect blood vessel walls, particularly in the brain. This affects blood vessel walls in the brain, leading to the characteristic stroke-like episodes that define the syndrome. MELAS is a relatively rare condition. Its exact prevalence is difficult to determine, but estimates suggest it affects approximately 1 in 40,000 individuals. Because it is a genetic disorder passed down from mother to child, it can appear in any population. However, due to its rarity, large-scale epidemiological studies are challenging to conduct. The signs and symptoms of MELAS can vary widely among affected individuals and typically begin in childhood, although onset can occur at any age. The classic triad of symptoms includes stroke-like episodes, encephalopathy, which involves brain dysfunction, and lactic acidosis. Stroke-like episodes manifest as seizures, severe headaches, muscle weakness, and altered consciousness. Encephalopathy may lead to cognitive impairment, dementia, and psychiatric disturbances. Other common symptoms include muscle weakness or myopathy, recurrent headaches, vomiting, loss of appetite, and short stature. Some individuals may also experience hearing loss, heart problems, and diabetes. Diagnosing MELAS can be challenging due to the variability in symptoms. The diagnostic process often involves a combination of clinical evaluation, laboratory testing, and imaging studies. Blood tests can reveal elevated levels of lactic acid. Muscle biopsies can show characteristic ragged red fibers, which are abnormal muscle cells with accumulations of mitochondria. Brain imaging, such as MRI, may reveal lesions indicative of stroke-like episodes. Genetic testing is crucial to confirm the diagnosis by identifying mutations in mitochondrial DNA. Furthermore, cerebrospinal fluid analysis may be performed to rule out other conditions and assess for elevated lactate levels. While MELAS is primarily caused by mutations in the MTTL1 gene, different mutations in other mitochondrial genes can lead to varying degrees of severity or presentation. Some researchers propose classifying MELAS based on the specific genetic mutation and the severity of symptoms. However, there is no universally accepted classification system at present. Currently, there is no cure for MELAS. Treatment focuses on managing the symptoms and preventing complications. Supportive care includes medications to control seizures, manage headaches, and reduce lactic acid levels. Coenzyme Q10 and L-carnitine supplements are often prescribed to improve mitochondrial function, although their effectiveness is still under investigation. Physical therapy can help maintain muscle strength and mobility. Dietary modifications, such as avoiding high-sugar foods and ensuring adequate hydration, may help manage lactic acidosis. During stroke-like episodes, prompt medical attention is crucial to minimize brain damage. Unfortunately, there are currently no proven strategies to prevent MELAS because it is a genetic disorder. Genetic counseling is essential for families with a history of MELAS to understand the risk of transmitting the condition to future generations. Prenatal testing may be available to identify affected fetuses. The prognosis for individuals with MELAS is variable. The disease is progressive and the severity of symptoms can worsen over time. Stroke-like episodes can lead to permanent neurological damage and cognitive decline. Life expectancy is often reduced, with many individuals succumbing to the disease in childhood or early adulthood. However, some individuals may live longer with careful management and supportive care. Research is ongoing to develop new therapies that target mitochondrial dysfunction and improve the quality of life for individuals with MELAS. Recent advances include exploring gene therapy approaches and developing drugs that can enhance mitochondrial function or reduce oxidative stress. These are exciting avenues for future treatments.